Texas does not have great health numbers. In fact, it has terrible health numbers. Lots of chronic disease, lots of obesity, there's lots of poverty here and poor levels of education. How do we overcome that in order to improve the health of everyone? And I think technology is one of the ways that we can start to make that happen. We looked around to try to understand what were the needs and what appeared to be the big health issues, and it became pretty obvious that people were very concerned about diabetes, a big problem, and it was also clear that obesity was what was driving this. And so we decided we needed to measure the burden of disease. Decided to develop a cohort, a randomly selected group of people from the community. So we're going to create a way to get the science to actually make a difference in the community, not just publish papers. So this cohort started to grow. Out of this growth came some opportunities to create collaborations. We have a lot of very good data on many issues, not only diabetes and obesity, but on heart disease, on liver disease, which is a big problem in our community, on mental health. And so that has allowed us to start to attract collaborators, to start publishing papers with them on the data from our population, but also to develop new strategies and to write grants. What's happened, of course, is with all of that, we've developed this really large database. It has clinical data, epidemiologic data, it has demographic data, laboratory data from our clinical laboratory. We also have a lot of imaging data now because we're doing ultrasound, a lot of ultrasound, and we're doing some genetic studies with various collaborators. So what's happened is that all of this has meant we need a better way to provide access to the data to our collaborators. And one of the reasons for thinking about using the TAC, I should mention that we're also very much a part of the clinical translational science program for Texas, especially for UT Health in Houston. And so through the CTSA and now the UTRC, we contacted you to try to see if we could migrate our data into a cloud or into some kind of system where our collaborators could get at the data more easily and be able to conduct their analyses. So we have all these collaborators and we're developing more of them. So we want to be able to create a large database that will accommodate all of our collaborators. And I think it's important for us, it's important for our collaborators, and I think it'll make the whole research enterprise in South Texas a lot more efficient.